The country has suffered. The world has suffered. 184 other countries have suffered. Therefore, my administration is issuing new federal guidelines that will allow governors to take a phased and deliberate approach to reopening their individual states.
That is U.S. President Donald Trump announcing what he is characterizing as a plan to restart the economy in the United States. A number of details, I think, that are significant to get across. First of all, that a certain number of criteria would have to be met by a state, for example, in order to begin what he and his task force have termed a three-phase approach. The first phase would be more strict, and then it would get more lenient as you went on. Different conditions, for example, placed on the number of people you can get together with, how close you can be in public settings. You have to be 6 feet apart. If there can be elective surgeries, if schools can resume, that wouldn't happen, for example, till phase two. Until phase two, it would happen according to the task force and Dr. Birx, who explained it on a sort of state-by-state basis, and it would ultimately be up to the state to prove they are ready to enter those phases. So there isn't a specific timeline attached to that approach. I do think it's important to get some expertise and some expert analysis on what you just heard from the president, because it could be impactful here in Canada as well. We'll get that from Dr. Isaac Bogoch. He's an infectious disease physician and clinician investigator at Toronto General Hospital Research Institute. Hi, Dr. Bogoch. Good to see you again.
Good to see you as well.
So a ton of information there. I wasn't able to see the slide that sort of explained exactly the criteria that a state would have to meet before it could enter into this phased-in approach, or phased-out approach, I guess I should say. But it sounds like testing is a big component of it, as well as the number of cases. I want to start off, though, on the premise that sort of underscored everything that the president talked about. He said the peak is over. And he said that very specifically. Is that accurate?
In all fairness, it's kind of hard to know. And really the way you can understand that is by ensuring that there is adequate diagnostic testing and a reliable source of diagnostic testing without barriers to these tests. He might very well be right. I just think it's challenging to know. And really, as Dr. Fauci pointed out, there's some very different epidemics in different regions of the country. And, some places are further along than others. Some places were more impacted than others. So there might be different peaks in different places. And I think it's interesting how they're really taking a patchwork approach to getting things started rather than a more unified approach. But maybe that makes sense, given that parts of the country are probably over the hump, whereas others may just be more at the beginning of their effort.
Yeah, that's what I wanted to ask you, because I do think there are implications for Canada as well there, because we have seen a very big difference depending on the province you live in, especially when it comes to the spread of the virus, the rate of hospitalization, all that kind of stuff. We know some premiers are thinking about talking about what the plan would look like to restart the economy. Is it, at the end there, the president was asked, for example, like if you live in Montana or Utah, is it possible tomorrow these phases could start? And he said, yeah, they could if they meet those criteria. Yeah. Do you think it might end up looking something, I mean, I know it's not going to be identical, but something like that in the broad strokes here in Canada?
It might. It very well might. And we've heard from Alberta recently saying that they're sort of getting ready or at least thinking strongly about what those next phases would be. And certainly the premier had outlined, I guess a more detailed plan than what we've heard from some of the other provinces, saying, this is what they will likely be doing in the foreseeable future. In all fairness, I think it's great to plan ahead, and it's great to think about what the next phases might be and how different provinces and how together as a country we can start to loosen these public health restrictions. But not a second should we even think about doing this at this moment in time, because, we might just be starting to see the flattening off of the curve, but I don't think that anyone should even consider lifting these restrictions until we see a sustained reduction in the number of new cases per day. And I think one of the other concerns, too, is, if one part of the country opens up but other places are still locked down, there still might be interprovincial travel. In fact, there very likely will be interprovincial travel in addition to, if we think about analogous to what's happening in the United States, there will be travel between the states. And, there may be setbacks because of people mingling. And if there's certainly looser restrictions in one area and tighter restrictions in another area, it might ruin everything and set it back in areas that are farther along. So it's tough to know the right way to do it.
Do you think, I guess I'm wondering what the metrics are or the triggers are for that conversation to begin in this country? You know that lots of Canadians are going to be watching this tonight thinking, hey, should we be having this talk right now as well? What would you say to them?
I absolutely think we should be having this talk. I absolutely think that we should have a detailed plan in place of when we can start lifting these public health restrictions, how we're going to do it in a detailed manner, what metrics we're going to be looking for, exactly what we're going to be doing, and also, and really this is planning ahead. I'm not saying this is going to be done today, but this is in the foreseeable future, in the weeks or months ahead at least. And it's extremely important to plan ahead for this so that the general public is aware and knows what to expect. And also, I think the important message that they parlayed in the United States as well was that there may be setbacks, and it's not always a linear path forward. You might have to regress a little bit and reimpose some of these public health restrictions and reimpose some of these public health measures if there are signs of an outbreak in a region. And I think it's extremely important that people recognize this. And again, not to belabor the point, but it's way too soon to actually do this here in Canada.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.